Good afternoon. My name is Maggie Trevino. I'm with Services, and I'll be going over the benefits for Xoriant staff employees effective for January 1st, 2018. I will be reviewing what is open enrollment, plan year and eligibility, United Healthcare Medical, which are your new PPO options that will be replacing Anthem Blue Cross, the Kaiser Medical options for California only, the new dental option with United Healthcare, which will be replacing Anthem Dental, VSP Vision, Life, Anthem Short and Long-Term Disability, Sun Life Voluntary Insurance, Flexible Spending Benefits, and our contacts at Services. So what is open enrollment? Open enrollment is the ability to your medical carrier. So if you previously were on Kaiser and were considering a PPO, you can enroll into United Healthcare effective January 1st, or vice versa. If you were on the Anthem PPO and you're now considering Kaiser, you can make it. You also have the ability to add or remove coverage for your dependents. So if you had children on the plan, waive coverage for yourself. Now is the time for you to have the opportunity to enroll. You can cover your children up to the age of 26. Also a good time to update your beneficiary. And if there are no changes, you must wait until open enrollment to make changes unless you have a qualifying. So basically, whatever plans you elect, whatever dependent status you elect, you are locked in for the year. You don't have the ability to make changes any time throughout the year. If you waive the coverage, you cannot just come on at any time. You have to have a event. An event means that you got married, divorced, you had a child, adopted a child, you are a dependent that reaches the age of 26, qualify for your parents' insurance. Dependents lose group coverage elsewhere. So if your spouse lost their coverage through their employer, if your dependents, the children lost coverage through your, you have the ability to enroll them onto the Xoriant plan, but you only have 30 days. The carriers are very strict. If you don't make those changes and notify HR within 30 days, you will have to wait until next year, and it would be effective January 1st, 2019. So the plan year is effective January 1st, 2018, and it'll run through December 31st, 2018. The open enrollment period is effective December 4th through December 15th. You will receive an open enrollment email with instructions on how to log in and elect your coverages for the January 1st, 2018 plan year. So please be sure to be on the lookout. That email will have all the instructions and make sure that you're aware that it will be on December 4th is when you'll have the ability to log in. All employees must elect coverage in PlanSource or they will be dropped from coverage for 2018. And your next opportunity to enroll will be effective January 1st, 2019, unless you experience a qualifying event. So again, very important, if you do not go into PlanSource from December 14th to December 15th, you will not have coverage. You need to make sure that you go into PlanSource and elect your coverage for the January 1st, 2018 plan year. So your first PPO option, this is the United Healthcare PPO 500 that is replacing the Anthem Blue Cross plan, and it is a PPO option. And so you always want to make sure that you're staying in network to get the best coverage for your dollars. So you will have a new carrier, new ID cards, and so you want to make sure that if you have any current doctors, you'll have nurses that you'll want to check to see if they're contracted with United Healthcare. If they're not contracted with United Healthcare, we can assist you with finding a contracted provider. Otherwise, you will be out of network. And if you're out of network, you'll feel like you don't have good coverage. So the deductible for this plan is $500 if you're single, or $1,000 if you have a family. But if you look at a network, it shows $1,000 if you're single or $2,000 if you have a family. The individual out-of-pocket maximum that means that is the most that you will pay out of your pocket in a calendar year. These run from January to December. And so for you had $1 million bill, or you were in and out of the hospital multiple times throughout the example, if you You would not be responsible for more than $3,500 out of your pocket if you're single, or $7,000 if you have a family. Again, if you look at a network, you'll see that it doubles. The deductible is what you're going to be responsible to pay before United Healthcare pays. For an office visit, it's just $20 copay. For your preventative services in network, at 100%. If you go to a provider that is not contracted with United Healthcare, it will not be covered when you get your annual checkup. Hospitalization, so if you are in the hospital or if you have to have a surgery, you have that $500 deductible, that one-time deductible, and then you're going to pay 20% of the bill up to $3,500. If you hit the out-of-pocket maximum, United Healthcare is going to cover the rest of the bills throughout the year at 100%. There'll be no charges to you. Diagnostic lab and x-ray are covered at 100% in network. Emergency room copay is $100. And then mental health and chemical dependency, those are covered as any illness. So inpatient is a hospital co-insurance, and then outpatient visits are your office visit copays. And then prescription drugs is $10 for generic, $25 for preferred brand, and then $50 copay for non-preferred brand. If you ask a doctor's office, do they take United Healthcare, they will all tell you yes. You need to make sure that they have a contract with United Healthcare, because if they don't have a contract, you're going to be out of the network. Your next plan option is the United Healthcare PPO 5900. This plan is a major medical plan. The premiums are much lower than the traditional PPO 500. And so this is a great plan if you're somebody who is pretty healthy, doesn't go to the doctor that often, but you just want to make sure you have some major medical coverage. So the deductible for this plan is $5,900 in network for individual and $11,800 for a family in network. Again, you'll see out of network, it doubles. The out-of-pocket maximum on this plan for individual is $6,350, and then the family is $12,700. In office visit copay, you get 3 visits. Your first 3 visits are a $35 copay. If you were to have more than the 3 visits, then you will be subject to the deductible. So you'll see the full cost of the office visit with the United Healthcare discount, of course, but you will see the full cost of the office visit. So if it's $200, you would pay $200 on the 4th visit. However, once you max your deductible of $5,900, the plan pretty much pays everything else at 100%. So you'll see preventative services in network are 100%. Hospital, outpatient surgery, diagnostic lab and x-ray, excuse me, emergency room, ambulance, mental health and chemical dependency are 100% after deductible. So once you hit the $5,900, everything else is 100%. Prescription drugs, there is a brand name deductible, and so it's $100 deductible if you're single, or $300 if you have a family. Generic is a $10 copay. Preferred brand is a $30 copay, and then the non-preferred is a $50 copay. Excuse me, I'm going to cough. Excuse me. The online tools for United Healthcare members, you would access the myuhc.com. And so you can go to UHC and get information on your benefits and your coverage. Oh my gosh, I'm coughing. I'm good. You can find the doctor, manage your claims, manage prescriptions, track your medical expenses, as well as access an ID card. The website is myuhc.com, and it's a great website to definitely find a provider, make sure you're staying in network. Excuse me. And then you also have the Kaiser HMO $30 copay. So this is only. If you are somebody who travels, this might not be a good plan for you. You do have to go to the Kaiser campuses. So you don't have the ability to just see any provider. If you go out of network, it won't be covered. And so if you're outside of California, it would only be covered for life-threatening emergencies. There is no deductible. The out-of-pocket maximum is a $2,000 maximum for individual, $4,000 for a family. So again, if you're in and out of the hospital, have major medical bills, you're not going to be responsible for more than $2,000 individual and $4,000 for a family. It's a really great benefit. The office visit copay is a $30 copay. Specialist is also a $30 copay. And then preventative is covered at 100%. And then hospitalization is a $250 admit copay. Outpatient surgery, $100 copay. Lab and x-ray is a $10 copay. Advanced imaging, so MRIs, diagnostic, those would be a $50 copay. And then emergency room is a $100 copay. And then mental health and chemical dependency is also covered as any illness. And then prescriptions, there's no deductible. Generic is a $15 copay, and then the preferred brand is a $30 copay. Kaiser also has a really great website, which is the kp.org. You can go in and register. You can email your doctor, definitely save some time and money, because if you email your doctor, you won't have to go into an office visit, and you can save from having to pay copay, save from having to take time off work for you, or take time off school for your children. You can just email your doctor. You can view lab results. You can also pull immunization records for your children. So just a really great resource. There is a live healthy online tool, wellness coaching and classes, as well as online health assessments. Your new dental program will be with United Healthcare as well. This is replacing Anthem Dental. So if you have not used your dental insurance with Anthem this year, I encourage you to use it before the end of the year, because this plan will take effect January 1st. And so this plan has a $50 deductible for individual, $150 for a family. So if you had a family of 5, you're not going to pay more than 3 deductibles. But it is waived for preventative services. So if you're going and getting your cleanings, x-rays, there is no deductible. Your annual max per person is $500. So each person in your family gets $1,500 per year. And then the diagnostic and preventative services, you'll see in network, it's 100%. So just like the medical, if you go out of network, you're going to pay more money. So although it says 100% out of network, there is no discount, so you'll pay excess charges when you're going to an out-of-network provider. Basic services are your cleans, root canals, deep gum cleaning are covered at 80%. Also, filling are at 80% out-of-network, however, and no negotiated discount. Major services are 50%, so those are for crowns, bridges, inlays, dentures, those are 50%. Orthodontia for child only up to the age of 19 is 50%. And then the lifetime maximum is $1,500 per child for orthodontia. So unlike the annual maximum, this does not reset in January. This is a $1,500 lifetime benefit as long as you're covered under this contract. The network claims are reimbursed at 90th percentile UCR. So what that means is this plan still does pay very well if you have a dentist that there's dentists that don't contract with anybody, or you have a family dentist that you've gone to for years that's not contracted with United Healthcare. This plan still does pay really well. They will pay based on what 90% of the dentists in your geographical area will charge. So they will pay a very good portion of the benefit. Your vision is with VSP. So VSP, you have a frequency of 1 exam you get 1 set of lenses every year, and then frames are once every 2 years. The exam our copay, you'll see out of network, it's up to $50 allowance. So again, just like medical and dental, you want to make sure that you're seeing a VSP contracted provider. If you go to a provider that's not contracted with VSP, you will pay out of pocket, submit your receipts to VSP, and get reimbursed, and they're only going to reimburse you these allowed amounts. Materials are a $20 copay for lenses and or frames, and then your lenses are covered in full after the copay. Your frames are $130 retail allowance plus 20% discount off the balance. So if you were to get some frames that cost $200, VSP will pay $130, and then you'll get a 20% discount off the remaining $70. The contacts are in lieu of glasses. So if you wanted to get contact lenses, you can. However, it is in replace of your frames. So you can't get both. It would be one or the other. So you also have the life insurance and AD&D. This is still with Anthem Blue Cross. This has not changed. So it's provided by Xoriant to staff employees at no cost to you. It pays a benefit upon the death of an insured. It's employee coverage only. So again, this is a benefit that is paid by Xoriant, no cost to you. And the benefit is 2 times the earnings, $2,000. So it's based on your salary. It also includes accidental death and dismemberment benefit of 2 times earnings to a maximum of $750,000. So what that means is if you were to pass away in an accident, the actual benefit would be 4 times your salary to your beneficiary. Please make sure you have your beneficiary information current. It is guarantee issued that you issue is up to $475,000. So again, it's based on your salary. If you're somebody who has medical conditions, you do have, so it wouldn't cause any issue with you having to do any medical questionnaires or anything like that. So it is guaranteed. It doesn't matter any medical history. Anthem short-term disability, so employer paid benefit, short-term disability. This is an income replacement. It's 60% of the monthly earnings to maximum monthly benefit of $2,310 a week. There is a 60-day elimination period, and the benefit duration is 18 weeks. So what this means is that you do have short-term disability, but it actually, the coverage will not kick in until the 60-day waiting period, and then it will cover you under short-term for up to 18 weeks. If you were to continue to be disabled after the 18 weeks, you still have a long-term disability benefit. This is also paid for you by Xoriant. And so this is income replacement, 60% of monthly earnings to maximum monthly benefit of $10,000. And this has a 180-day elimination period. So basically it's a 6-month waiting period. And the benefit duration to age 65, which is Social Security normal retirement age. So the benefit will pay up until retirement. You also have an EAP, which is Anthem Resource Advisor. So this is actually a really great resource that is available to you. It's an employee assistance program type support, and it gives you and your family private access to work-life resources at no additional cost to you. This is also paid by Xoriant. It is privacy protected, so they don't have access to any of your information. And so what this does is you have 24/7 access to a phone consultation and referrals from anywhere in the United States, and it's unlimited access on Resource Advisor, Anthem.com website. And so you would be able to access counseling sessions for qualifying events, identity theft, victim recovery services, legal and financial consultations. There's also stress management, financial planning, budget, lots of great resources. So I encourage you to either give them a call or go onto the website because they can definitely assist you. And it does help with stress management as well, for whether it's in your workplace or personal. You also have Sun Life Voluntary Life and AD&D, and so this is the opportunity to purchase more life insurance. And so this is at your cost. You can purchase in units of 10,000 up to 100 for you. The guarantee issue is 150,000. The units of 550,000, 4,000 up to 250,000 for your spouse. And then you also have the ability to purchase life insurance for your children from a $1,000, $5,000, or $10,000 benefit. And the coverage is portable. You can take this coverage with you if you're no longer with the company. The spouse's amount cannot exceed 50% of your election. So what that means is if you were to purchase life insurance for yourself at $100,000, you cannot purchase more than $50,000 for your spouse. You also have some voluntary. This is also a coverage that is would be at your cost. And the coverage voluntary acts for off-the-job accidents only. It pays fixed benefits for specific injuries, procedures, or death as a result of a covered accident. It includes benefits for hospitalization, fractures, and dislocations, emergency room visits, and more. There are no health questions or pre-existing condition limitations. And this benefit pays directly to you to use in any way you choose, and in addition to any other coverage you may have. So this benefit, even though you have health insurance, if you had an injury or an accident, this money is going to be your money to use however you need or choose. The coverage is also portable, so if you're no longer with the company, you do have the ability to keep this coverage, and you would continue to pay for it directly to Sun Life. And it also includes a $50 wellness benefit each year. When you go in and get your annual checkup, you would just submit the claim to Sun Life, and they'll send you a check here, so it's for $50 every year. You also have Sun Life voluntary short and long-term disability. So although you have an employer-paid benefit, you do have the ability to purchase more. So this is short-term disability, and it provides coverage to replace your income if you're unable to work due to sickness or accident. And this policy provides staff employees with 60% of their weekly income up to $1,000 a week. And then the long-term disability provides coverage to replace your income also due to sickness or accident, and it will cover 60% of your monthly earnings up to $5,000 a month. Sun Life voluntary critical illness. This is a benefit that would cover. It's for covered illnesses, so heart attack, heart failure, stroke, coronary bypass surgery, end-stage kidney disease, occupational HIV, hepatitis B, C, or D, major organ failure, advanced Alzheimer's, Parkinson's, or cancer. So this is a critical illness benefit that if you were diagnosed with one of these illnesses, it would pay a certain amount of benefit to you, and so this is also voluntary and would be at your cost. You also have a flexible spending account. This is through the Advantage Group, and this is a healthcare FSA. The healthcare FSAs allow you to contribute pre-tax dollars to pay for qualified medical expenses. The maximum amount you may contribute for the 2018 plan year is $2,650, and then for dependent care, it allows you to contribute pre-tax dollars to pay for qualified dependent care. The maximum amount you can contribute each year is $5,000 or $2,500 if you're married and filing separately. The way the flexible spending account works is it allows you to set aside pre-tax dollars to help pay for healthcare expenses. The annual minimum amount that you can contribute is $100, and the annual maximum is $2,650. And so when you're electing the flexible spending account contribution, you want to be conservative because this does have a use it or lose it rule. So if you don't use the funds by the end of the year, you will lose it. However, it also gives you the ability to use the funds up front, and if you were no longer with the company, basically the company would lose it. So it's a benefit that's been mandated by the federal government, so that's why it's created this way. And so this does help you set aside pre-tax dollars. So if you know you're going to have a surgery, or you have prescription copays throughout the year, or you're going to have some dental work, could be a great option to help you set aside some pre-tax dollars to pay for those types of services. And so some people choose just to do the $500 rollover benefit, because if you don't use it, and $500 can be rolled over into the next year. Dependent care does not have the use it or lose it rule, and so the minimum is $100, the maximum is $5,000. And the way dependent care works is you have to contribute first, and then you can actually submit to get reimbursed for the dependent care. But it does allow you to set aside those dependent care costs pre-tax. Dependent care FSA grace period for eligible expenses must be incurred between January 1st, 2018 and March 15th, 2019, and the claims can be submitted for reimbursement up until March 31st, 2019. There's also a parking and transit benefit. This is a $260 monthly maximum to help pay for parking, or if you're somebody who commutes, the transit benefit could be a great benefit for you because you're setting aside pre-tax dollars. This does not apply to the use it or lose it. You can cancel at any time, and you can select the amount that you'd like to contribute. So FSA, you cannot cancel at any time. You have to have a qualifying event. And so again, it's pre-tax dollars. And so here we provided a scenario without the FSA as well as with, so that you can see the benefit of having it. And so if you look here, this example has a weekly earnings of $400. So without the FSA, there's no contribution. You'll see taxable wages are $400. So the taxes are $110.60. The eligible out-of-pocket expenses, so let's just say this person was going to have some dental work, and so they decided, that was going to be the cost of $110. The net take-home pay is $179.40. If you look over to the right with the FSA, the $400, and if you look at the FSA contribution of that $110, the taxable wages are reduced from $400 to $290. So the taxes paid on that are reduced, and then you have your eligible out-of-pocket expenses. So this, if it's dental work and you're going to pay for it anyway, it's nice to be able to take it out of your FSA. So you'll see the net take-home pay here is $209 versus the $179, and so there was some annual savings there. So all employees must elect coverage in PlanSource or they will be dropped from coverage for 2018 and will not be able to enroll again in next year effective January 1st, 2019, unless you experience a qualifying event to open enrollment. So we just can't stress it enough. Please make sure that when you receive the email and the information that you log into PlanSource and that you update and elect your open enrollment elections for this upcoming 2018 plan year. We also are providing you with our contact information, and so as your broker, we are here to support you. So if you have any questions throughout the year, you didn't get your new ID cards, you have claims that didn't get run through your insurance, you need us to help you find an in-network contracted provider, you can call our 800 number. You can email the mybenefits@insur.com, or you can contact Christina Calvetti, who's my account manager, or Lisa Fan, the customer service associate. Our team is here to support you. So rather than you having to go to HR with personal health information, you can always come to us directly, and your information is privacy protected. Or question. So I encourage you to reach out to us. You might call the carriers and call those 800 numbers, and they just put you on hold or send you in circles, and we can get quick results for you. So again, I encourage you to reach out to us and ask any questions about your insurance throughout the year. And that concludes the session. I'm going to open this up for questions.